The global burden of bone structures is high up there in the millions, and an example of 2019 is that the bone structures globally stood at 178 million and 455 million people were living with bone fracture related symptoms. That is a big number, but at Mulago you also see that traumatic bone loss stands at 50%, and that's according to a study done by Mulago National Referral Hospital. So today we are here to discuss bone fractures. What are they? What causes them? Apart from the obvious like an accident, how else can your bones be in danger, and how should you take care of them? I am Viola Sasia, and I'm very happy to have you once again for this episode of NTV Medical Matters, and we are supported by Bill and Melinda Gates Foundation. We are glad to have you, our dear viewer, and this morning we are joined by Dr. Abubakar Kabunga Mbogo, and he is a consultant orthopedic surgeon at Nakasero Hospital. But before we actually dive into our conversation with our good doctor, we also had a chance to talk to one of our colleagues who actually got into an accident, and he suffered multiple fractures, but he's on his way to recovery. So let's first look at this story before we start our conversation this morning. Thank you, George, for creating time to speak to us, and we are very happy to see that you're breathing and you're okay. We miss you at work. So talk to us about the moment this accident happened, the moment you got the fracture. What were the events surrounding the entire thing? Where did you fall? What were you doing? And how did you end up with that injury?
What happened was, as my usual routine, I woke up early morning, around 5:30, prepared myself, and head for work. I drove all the way from Kasangati up to Serena, whereby when I was trying to enter the Serena main gate, I collided with some border guy who had no headlamp on, and that day it had drizzled, so it was still a bit dark because it was around, this accident happened around 6:40. It's when I saw this guy who came speeding, rammed border guy and rammed into me. I fled in air. I came roaring and hit myself down. What followed after, I can't recall. So a few minutes later, I gained consciousness, and I saw my leg facing at the back. So then I asked myself, is my leg okay? So I tried to pull my leg. When I pulled it, it just flipped off my hands. Then one word I said, I'm finished. Then now next thing that I did, I held my leg. I first put this one straight. I held this one properly. I also put it straight together. Luckily enough, while I was still crying for help, I saw one of our colleagues, Bwanka. He was on his way going home. Then one thing he said, he was like, oh my God, isn't this George? This is George's bike. And then he ran to me, and indeed I was the one. So he was in shock. So he started now panicking. Then from nowhere again, Boniface also surfaced. So now their phone calls started running up and down. So they came to me. God was among those that I call my rescuer, who came with a car in a very short time. So they carried me to the car and rushed me to the hospital.
Yeah, it really sounds like it was really orchestrated by God, having to fall near the workplace and then your workmates finding you and then cars being available. Wow, it's just so unbelievable. But when you go to the hospital, what exactly happened? You were rushed to the hospital by some of our staff. What happened there on arrival?
what happened in the first place, my surgery was to take place a bit earlier. But you people, I want to tell you something. Not until you reach there, it's when you get to know what really happens in this world. I want to assure you that the theater was full, like in and out, in and out. And for that reason, it even took me 2 days before being worked on. But the doctors were managing the situation, so I could not feel any difficulties. I was living normally. Of course, before they first tell you what exactly is going to happen, so I was told they are going to do an opening of the leg. Then they will have to fix a plate. They are called fixators. Then they cover again. So that's what the doctor told me at first, and also told me that they were going only to sterilize the downer part. So now when I got into the theater, they began their work.
But how has your life changed as compared to what you used to, do on a daily basis?
As you know, I'm a family man. I have kids to take care of. And whenever you leave home and go to work, you know what it means, because at least when you come back home, you come with, a bag or something to put on the table, which is no longer the case. Someone who used to wake up in the morning, you go to work, come back home, the kids will welcome you with a polythene bag. But now you are there, you are looking at them, they are also looking at you. So, and of course, being the head of the family, they all depend on you. So that's the most paining thing. And each day that passes, you keep asking yourself, for how long is this going to be? But I know with God, all will be well, and very soon, I'm sure I'll get back on my leg and start working.
Yeah, I can imagine. I can imagine a child looking at you and thinking, "Oh, you used to come home with Kavera, now you don't have it." It's tragic, but it will get better. Let's look at your story, and for somebody watching, if you were to talk to them about your experience, which truly, to me, sounds spiritual. The whole thing was just too smooth to be believable, but I guess that is God. But what would you say to somebody watching and who's also going through a similar situation?
Well, what I can tell to someone who is watching me, even me, I could not really understand why things happen that way. And as you've mentioned, there was God in it, because I imagined, and this kept coming into my mind, that if this had happened away from my workplace, surely what would have happened? So for that reason, I thank God that everything happened at the workplace, and I was rescued and been able to receive medical attention in the shortest time. So that's why I encourage that surely we should always put God first. And that morning, as usual, before I leave home, usually I first pray. But I want to assure you that morning when I woke up, I tried to pray. The prayer was not coming my way. I stopped a bit, I tried again, the prayer was not coming my way. So I said, I will complete my prayer on the way. And along the way, I want to assure you, I tried to pray like 3 times. So what came into my mind the moment I fell. I was like, oh, no wonder my prayer could not get to the end. And imagine if I had ignored, what could have happened to me. But because I insisted to God, so God, that's how he saved me.
But we are very happy to find you, and we wish you a quick recovery and hope to see you at office soon. Once again, thank you so much for joining us this morning, dear viewer. I am Viola here at NTV Medical Matters. That was George. He's one of our colleagues here at NTV Uganda, and he got into a terrible accident, but by God's grace, he is there. He's recovering. We paid a visit, and you've had his story. So that's part of what we are discussing today, which is bone structure. I don't know why I can't bring it out. Bone fractures. Yes, and so we are here with Dr. Abubakar, and I'm very happy to have you here. So let's start off immediately by understanding in simple language what bone fractures are.
Thank you. So thanks very much for inviting me over, Viola. Such a pleasure to be here talking about fractures. This is what we do day in and out. So a bone fracture in simple terms is really a break or a crack which can result in the separation of the bone fragments. And there are many kinds of fractures. We classify them according to a few ways. One of them is open or closed injuries. Open injuries are those that where the skin is broken, the bone somehow finds its way out, or whatever insulting factors break the skin and it opens into the fracture environment. We also call them compound fractures. Obviously, then the closed fracture are those that the skin is nicely intact without any problems. We have other ways of categorizing them. We can have a displaced fracture or an undisplaced fracture. That tends to guide us whether it might require surgery or not. Yeah. The other sort of types of fractures that are important to know about are osteoporotic fractures. This is when one's bone mineral density is not good enough, and therefore a minimal force results in the fracture. We also have a category of what we call a pathological fracture. This finds a diseased bone that is already fragile. For instance, when cancer eats up part of the bone, in those cases where cancer is spread, it makes that particular area weak, and therefore just a minor injury such as perhaps rising from chair, you get immediate pain on that particular area. And then stress fractures are those we commonly see in either the military personnel or sports people or those who run on the roads. Essentially, the concept of stress fractures is that you're not giving enough time for bone to heal. Bone is a living tissue. Whenever we are running or doing things, it's sort of overuse, and then it has to require time to recover.
I'm actually surprised to hear that it's a living tissue. I had no idea. I just thought bones are just bones because I have seen jewelry made out of bones, actually.
Oh, that's interesting. No, bone is a living tissue. It has an environment that is constantly changing. It has blood vessels, it has cells that deposit bone and cells that eat away bone. So it's a constant dynamic environment. That's why we have the concept we call remodeling. You see a bone that is bent, particularly in children, and the doctor says, it will heal. And you're thinking, how will it heal when it's already bent? But the concept of remodeling brings out this aspect that bone is living tissue. It will sort of re-engineer itself and align itself very well. Yes. So those are the main categories of fractures that I think we need to know about.
You spoke about something of a low bone density. What causes that, but also how can it be rectified? I'm very interested in that.
A very good question. So part of the natural process is aging. And as we grow, we peak in terms of bone mass, how strong it is in sort of our late and early 20s. And then after that, I'm afraid it's downhill. Mm-hmm. The bone mineral density starts going down. And it's more marked in perimenopausal or postmenopausal period, particularly more for the women. Mm-hmm. But overall, a bone mineral density decreases. And that means with time, with age, your propensity and risk for fractures goes high. And therefore you see some of these nice little old ladies. I was just hanging my clothes on the wire, I tripped and then fell and a hip is broken.
Yeah.
That is more indicative of low bone mineral density. So in terms of treating it, it has to start way before
it happens.
Mm-hmm. You try to prevent it. Things like good nutrition, regular exercise, maintaining optimal body weight, those things help. Why exercise helps? Exercise makes bones stronger, and nutrition obviously helps to rebuild good bone. Things like calcium intake, so all those sort of foods that help with, like the dairy products, good calcium containing foods go a long way in preventing. Then obviously at the time when you're expecting that your risk is going up, and I see here we're not very good at measuring bone mineral density, but it's something that people need to be aware of that make you a higher risk for fractures. So there are tests that we do, such as check your vitamin D levels, check your calcium levels now and again, but most importantly do what we call a DEXA scan, particularly if you're a high risk group. Yeah. And there are other diseases that also reduce your bone mineral density.
When somebody is ill, say for example is suffering from malaria, and they keep talking about joint pain, what exactly is happening?
That's a little bit different. That's more of a manifestation of the disease process, where inflammation in different parts of the body bring about these symptoms. But obviously, joint pains are more noticeable because they're areas that move, are busy. So people will always notice that.
And speaking about noticing, doctor, some people have pain, but they do not know what happened, what went wrong. They don't even know whether they have an injury, really, but they just have pain, say, for example, in the foot. Yeah. So how do you know that you have a fracture, especially when you don't have open skin, broken skin?
A good question. So fractures present in many ways, but usually usually, not always, but usually there is an inciting event. So for instance, you may have had a fall, but you did not think much of it, or a high jump and you landed awkwardly. And then once you start experiencing pain, which can lead to limping, for instance, that raises the possibility of, is it a fracture or is it a simple sprain? Yeah. But and that's when you need a good assessment, and many times, particularly for stress fractures, in sports people or military, as we said, or even just walking. You don't usually walk, and then suddenly you decide to do 10 kilometers walk. Your bones are not used to that sort of stress, and therefore, going back to the living tissue, the repair has not happened enough to allow you to carry on, and then that results in what we call a stress injury. And so therefore you need a good assessment. You would be tender, usually by a qualified doctor. You'd be tender where we are suspecting the fracture, and then x-rays are usually the first imaging or diagnostic modality to help us guide us.
You have brought some samples of the bones within the human body here.
Indeed.
I have a question about what are the worst bones to break in a human body that are very difficult to repair?
So there's two questions in there. What's the worst break? I think the worst break would be one that would easily result in loss of life. Okay? And bones are not, or bone fractures are not simply just fractures, but sometimes they actually lead to death. So I'll take an example of the pelvis. I don't know if the viewers can see
Sorry
the pelvis.
about that. Yeah.
So the pelvis is just one of that complex structure where there is a very intimate connection with blood vessels very close to the bony surfaces. So if you then break, say through a road traffic accident or a car crash and injures your pelvis and breaks, then very likely these vessels are going to be disrupted. And as you can see, there's a large volume within the pelvis. So if blood collects in here, essentially you're bleeding to death. So this is a very difficult area to break. The other, obviously, is the spine. The spine, as you know, houses our spinal cord, the nerves that help to control movements, control bladder and bowels, and all the limbs. So if you fracture, as an example, say between the thoracic and lumbar vertebrae here, you have the risk of completely paralyzing the lower part of the body because the neurological structures have been injured. So there's different ways of looking at which are the worst bones to injure. Femur, which is a thigh bone, which starts at the hip joint, is also, it's the strongest and longest bone. But once it breaks, the amount of blood loss is quite significant. Almost up to 2 liters can disappear into the thigh. And so one of the, listening to George's story is quite moving. Unfortunately, it's one of many we're experiencing, and George is very lucky that he did not lose his life. But it brings out the concept of polytrauma, where multiply injured, several bones involved, and not just bones, but other structures that may be involved. It could be the head, it could be the chest, it could be the abdomen. All those things combined together, they need a much organized, systemic way of approaching, assessing, and treating them in order to come out well the other end.
You pointed out earlier that I asked 2 questions in one. I think I'm going to do that again. So my question is about the foods to eat that will aid recovery, and I just need specific foods. And another question is I don't know whether it's a myth that bones in adults do not recover. Yeah.
So starting off with the foods, the most important concept here to take away is a balanced diet. Make sure you have the proteins. Proteins are very important. A lot of our skeleton structure is made of proteins, plus obviously other things. So protein foods, we know, eggs, chicken, fish, that sort of thing. But we also need the minerals that help with covering things. So calcium, vitamin D, vitamin C, zinc, magnesium, and a few supplements are already on over the counter that you can get. Other foods that contain minerals, things like dodo, nakati, those things are very helpful in maintaining a good diet for bone health.
Okay, so
and then
recovery. And on that recovery part, before you talk about the adults, let's also fix in the children. So children sometimes are born with poor bone structure or misaligned bones. At what age is it okay to correct them? But is it also guaranteed that these bones can become corrected?
Yes, they can get corrected. One of the commonest issues we have with particularly bone health in children is, again, mineral insufficiencies or deficiencies, vitamin D, the calcium, or some other genetically sort of causations for these things. But they can be corrected if they are identified early. And that's why if you think you're not happy with how your child is growing, whether they are too much bowing, or too much knock knees, just go out and seek a pediatrician review or an orthopedic pediatrician surgeon to have a look and give you some advice.
And that's up to what age?
Up to the time they are fully what we call bone maturity, which tends to happen at about 14 years of age for girls and 16 years of age for boys.
Okay, let's pause there. We are going to take a break, Doctor. When we return, we shall continue our discussion on bone structure. Bone fracture and bone structure are just dancing in my head. I just can't get it out. But let's take a break. NTV Medical Matters returns shortly. Stay with us and make sure you prepare your questions, because when I ask you to call in, I hope you'll be ready to ask a good doctor what you want to know about bone fractures. You're watching NTV Medical Matters. Welcome back from that break. I am Viola Sassia, and we are discussing bone fractures this morning, joined by Dr. Abu Baker from Nakasero Hospital. And before we broke off, we're speaking about how to recover from a bone fracture as an adult. Is it possible, or are you stuck for life? A clear example is actually George. We were watching his story earlier, in case you've just joined us, but George is recovering very quickly. I was very impressed when I saw him. Yeah. And so that then beats the fact that people believe adults cannot heal from a fracture. Yeah. No, adults heal. In fact, we operate even 100-year-old people who have had their hips broken. So that's testimony that fractures heal. However, it has to be said how the whole approach from the time of the accident, what are those first 1 to 2 hours, how have they been dealt with in order to avoid long-term or even immediate death, and then the timely approach to fracture fixation, as well as the recovery, rehabilitation, the physiotherapy, and then the nutrition that is covering all that. Yeah, he actually mentioned that he was delayed for 2 days because of congestion. So how does that impact him, or how does that affect his recovery? That can have a significant effect on to how he goes through. But obviously, in his case, he probably did not have significant other injuries that could have resulted in a compromised outcome. We have the concepts of early total care. We have a caller on the line. We have a caller, yes. NTV Medical Matters, are you there? NTV Medical Matters. What? When you call us, please step away from your TV set so that we don't have an echo or feedback, because that sounded like somebody was crying, which is quite unfortunate and unexpected. But we can. You mentioned something important about the diet. What are some of the foods we should avoid on our way to recovery? Kind of things to avoid, really. Alcohol is not great. Smoking is not great. Sugary, fizzy drinks, they contain phosphoric acid, which just chips away on healing bone. So those are important things to avoid. Obviously, other illicit drugs, etc. But ensure you keep well hydrated and all the other good foods that we've mentioned. But it's also important, and I'm seeing it nowadays, people who have had injuries and are struggling to go through rehabilitation just simply because the other muscles that they're going to need to use to support them through are a little bit weak. In other words, they're being unfit leading up to their injuries. So for those, do you want to connect to another caller? We've got a caller, but our connection is getting interrupted, so you can go ahead. Yeah. I was mentioning, for those of you who have mothers or judges at home, and you're trying to prevent some of these injuries, just ensure you give them some sort of, or guide them into an exercise program that aims at working on their strength, working on balance, because these are things that are going to help them. In case, God forbid, they had an injury, their recovery will be much faster and will be more effective. So in other words, if you're in your early 30s, 40s, 50s, look after yourself now as a bank investment for the future. How do you medically treat fractures? What are some of the interventions? Oh, before we go to the treatment, we have a caller on the line. We can hear you. What's your name and your question? Wow. Yeah. we are not so lucky today.
Okay.
Yes, medically, how do you treat fractures? I noticed George has got a metal of sorts. Do you later on take it out actually, or do you keep it there?
Not necessarily. So fractures can be managed in two ways. One is the non-surgical. Not every fracture requires surgery. Some are undisplaced and in areas that could heal without necessarily surgical intervention. However, some fractures we would recommend surgery, such as those that involve near the joint, because you want the joint to be as anatomically positioned as possible. And therefore, you need to sort of open them up and fix them. And we have different devices we could use to that. It could be a plate and screws, which I've seen on John's pictures they used. Or it could be a rod inside the bone, which we call an intermediary nail. Or for what we call damage control orthopedics, in those very sort of emergent situations where we just need to stabilize the fracture and get the patient onto ICU quickly, we do what we call external fixation.
Yes, please. What's your question and what's your name?
Yes, good morning.
Good morning.
I'm called Matthew. I want Doctor to advise us on what we should do around backaches. Looking at the current working environment where someone spends over an hour seated on the laptop. Myself, I'm a victim. I tried movement, but I realized end of day I have backache. So what would be, considering the current work environment, what would be the best remedy the doctor would advise us to do?
All right, Matthew.
To avoid these backaches.
Thank you, Matthew, for your question. And that's a question on backache. Sometimes it could actually be just, a strain or a broken back. So we shall be answering that question. But I just want to remind you that on our social media, you can be a part of the conversation at NTV Uganda. And you can also go to our YouTube later on to find the entire episode so that you don't miss a thing. Our phone lines are open. Prepare your questions and make sure you call in. So let's have a second question. We shall have multiple before we move on. So who's there? What's your name and your question? We can hear you. What's your name and your question?
Hello?
Yes, please. Yes, please. What's your question?
I'm Letitia.
What is your question?
I'm asking.
Yes.
Yeah, I have a friend.
Yes, go on.
She has brittle bones, despite the fact that she's around 20 years.
Yes, please. What's the problem?
But her bones, usually she gets a condition whereby they can easily, if she overuses them, she feels a lot of pain like she's a regular. And they can easily, should I call it falling? I don't know. So I'm just wondering which kind of condition would that be, that someone at the age of 20s gets that severe pain. When she kneels down, she gets she's developing something else, whichever part of the body she has gotten friction with.
She feels pain. Okay, I guess she's off, Letitia, but it's a question about a 20-year-old getting pain within her bones. And I actually had something about being a sickler. I hope I had that right. But that's our second question. Any other caller on the line? I just need about 4 questions before we get to answering them. Okay, since nobody's coming through, we shall first get to these questions and then we get back. Okay. But our phone lines are open. Just make sure you prepare your questions and ask. Also, we have somebody. Thank you for coming through. What's your name and your question? Yes, please step away from your TV.
My husband recently got an accident and sustained minor injury.
Yes, please.
Hello?
Yes, I can hear you. Step out from your TV set.
Okay.
Step out from your TV set.
I was saying. Hello?
Yeah. Yes, I can hear you. Go ahead.
So I was saying that my husband recently got an accident and sustained minor injury.
Yes, please.
However, he keeps on leaking, there is still some pain on the, I can say, within the leg there.
Yes.
So I don't know what the device does, because by the time we went, we wanted to find Indian,
yes,
we were told that the bleeding had already stopped. So they just gave us painkillers but I still see him limping. Yeah? He doesn't move in a right leg profile.
Oh, he's limping.
Yeah.
Okay, thank you. Thank you. Wow. Yeah, so this is a question about limping, getting treatment, but the sign, if the signs or the after effects are still very evident, the husband is limping. Who's there? What's your name and your question?
My name is Kapono Alan.
Yes, please. Oh no. Yeah. So that. Yes, please. Yeah. Alan seems to have left an. Okay. Let's do the three. So the first question by Matthew is on backache and, yeah.
Unfortunately, back problems, backache is quite prevalent. It's the commonest cause is rather benign, but they can be very, very intrusive in terms of symptoms. It's usually a mechanical back problem. He mentioned the problem of sitting for prolonged periods of time.
Oh, yes.
One of the recognized risks for long-term back pain is prolonged sitting, as well as poor posture. Unfortunately, it's one of the things that fill up a lot of our clinics, back pain. And when we investigate them, we don't find anything particularly worrying. But obviously, once those symptoms settle, they can be disengaging, affecting work, affecting home, lifestyle, etc. So what I tend to advise, and I'm sure other orthopedic surgeons do, regular core strengthening exercises, flexibility exercises, good nutrition, avoiding prolonged sitting. If you're in a meeting that is going to be running for a few hours, try to take a few breaks of stretching, maybe after a sitting period of say 30 minutes or 40 minutes. Rise, stretch your what we call the psoas muscles, bend and stretch your back muscles. All those things help with pain. Just imagine if you bent your elbow for a prolonged period of time and then you stretched it, you'll feel a lot of strain here. So a similar concept is also happening in the back. If you sit for prolonged periods of time, the muscles sort of contract around the spine, and therefore when you suddenly stand or do other things, they're just used in a shortened position. Yeah. So by just getting used to always stretching them out, when you're doing your core exercises, stretch out and strengthen those muscles. I particularly like to emphasize the core strength around the back because the back, as it is surrounded by muscles. At the back, at the front, yes, the abdominal muscles are part of back health. So I'm not asking that you do go and get 6 packs, but it's certainly very helpful that your tummy muscles are strong, because with strong tummy muscles, they help suspend the spine very well. With weak muscles, the spine collapses on itself. So it's so important that you strengthen the muscles around the front, the sides, and the back, including the buttocks. So all the core muscles are important. So part of your exercise regime, don't just lift away or just do the treadmill. Also pay attention to your core.
We actually have exercises every morning here on NTV. On our morning show, Morning at NTV, we open by exercise. So please make sure you watch. Do not miss that segment, because what you're saying is actually very important.
Indeed.
Yes,
indeed.
And we have it. We are delivering it. So another question we have here, this person talks about her friend who is 20 years old but has got pain. Like if she lies down on one side for very long, she'll experience pain because of the friction. And I think she mentioned something about her being a sickler.
Yes. So there are many potential causes of bone pain. And on a show like this, it will be difficult to point you to what is the potential cause. I think what I would advise from the sound of the symptoms, she needs to really be assessed properly. So I would advise go seek an orthopedic surgeon to review, or a rheumatologist, or your sickle cell disease physician. And between those three, they should find a potential solution. But common things occur commonly, things such as vitamin D deficiency. Believe me or not, we're in a sunshine state country, but a number of patients we find with vitamin D deficiency is quite alarming.
Does that mean that we do not get it from the sun?
Correct. We're still running insufficient amounts.
We were told that we should be outside in the sun up to what time?
Usually mid-morning at the best, but even then, despite all that, we still have quite a few patients on record.
So do we need supplements?
Absolutely.
Okay.
Yeah, but also check out if you can vitamin D levels, because they account for a lot of bone pain that is unexplained. But as a sickle cell disease patient as well, bone pain could be part of the sickle cell disease process. So I'd like you to be seen and assessed properly.
And finally, we have got someone who called talking about the husband is limping. He got into an accident and he got treated, but he is still limping.
Yeah, again, this may point towards a missed injury. What you may call a minor may not necessarily be a minor injury. Again, I would advise to go speak to an orthopedic surgeon, let them examine you, take a good history. What you may have called a minor incident may not necessarily be minor. And then maybe they will need further investigations, including imaging such as X-rays, MRI, or CT, to get to the bottom of it. But from what you sound like, you need assessment.
Okay. We have a caller. We have a caller on the line. Yeah. Yes, please. What's your name and your question?
Oh, my name is Kapolo Alan.
Yes, please.
I got a knee injury before.
Yes, Alan.
So when I went for a scan, an orthopedic surgeon, he told me my knee was okay. But after a couple of time, because I'm a sportsman, I play basketball, but after a couple of time, when I continued playing, I received pain under my knee. So, but once I do some exercise like squats, I get relieved. But once I take a lot of time without doing the exercise, the pain comes back again.
Yes, Alan.
Yeah, so what would be the best advice for that?
Okay, thank you for your question, Alan.
Hello, Alan. So from the sound of things, when you say scan, I am assuming it is an MRI scan, because some people say I've had a scan when it was just an X-ray. But assuming the MRI scan did not show any obvious pathology to worry about, then, and that you've also reported that with exercise, your symptoms get better. That's actually a common phenomenon, whereby with stronger muscles around joints, the joints are protected. If you have weaker muscles, then the brunt of the forces that go through the body go through the cartilage and the joints. So the point we are getting away from you, Alan, and keep doing it. Stronger muscles, keep doing your squats, keep doing all your lunges, whatever you do, that will definitely help with your symptoms. However, if you think you have not had a full evaluation, I request that you go see your orthopedic surgeon, let them consider further evaluation, let them assess your gait, assess your muscles, assess everything, including perhaps further scanning, and they will come to the bottom of it.
Doctor, what are some of the complications that could arise from a fracture that's left not attended to?
So fractures, as you know, they disrupt the skeletal system. Obviously, the skeleton is the main driver of the muscles, of movement, and therefore, if you have something that is not nicely healed anatomically or otherwise, then deformity results. And with deformity, that can mean pain, loss of function, and by loss of function, if, for instance, your shoulder healed awkwardly, then you might be having difficult for sort of overhead reach. And those are things that we need day in, day out of our daily lives.
And quickly, why would somebody heal but does not heal properly, that they then rely on pain medicine? Because I've also come across people who rely on pain medicine and actually got addicted.
Yes, and that's the whole importance of seeking early assessment. so that we understand what the nature of injury is. The doctor will explain to you what you've done through the x-rays and further imaging, and then take you through the management pathway. That is whether surgery or no surgery, rehabilitation, physiotherapy. And then once you've followed them up till the end, you'll be able to map every point of the way what is stopping the full progress. Yeah. So in other words, the message is seek early assessment for these things.
As we wind up, how long would a normal fracture, say for example, I break my leg, God forbid, how long would it take in an adult?
So that varies, but we have rough estimates. Lower limb in adults can take even up to 3 to 6 months, depending on the bone and the nature of the injury. If, for instance, you have a low energy injury, that means there's not been as much destruction at the time of injury, so healing, whether through non-surgical or surgical means, may be a bit quicker. But if you've had a much more high energy injury, then if soft tissue is damaged, blood vessels were affected, that injury may take longer, therefore might require more expertise.
I'm imagining a bone that gets crushed in an accident, for example, where you have, say this is a leg, and in between it gets crushed, completely crushed, to powder. How do you put that back together for somebody to walk again?
It's amazing how bone and our bodies easily recover with the right care. There is the potential. So immediately after an injury, the bone or the body sends all these healing cells and mop away all the dead tissue, and obviously, the healing process starts. But it's not just that. We have to look at managing all the complications that are associated with a crush injury in order for the recovery to proceed well. So it's not as simple, but it's a process that ultimately will get well if managed well.
Are there cases where you have to cut off somebody's limb because of a fracture?
I'm afraid yes. There are those properly badly mangled limbs where you've lost the blood vessels that supply the rest of the leg, the nerves are all crushed, the muscles are all crushed, the bones are all crushed, and basically what we call unreconstructible injury. However much you want to reconstruct it, it's just going to be a very useless, painful limb to have. And it's a difficult discussion to hold between you and the patient and the relatives.
When you cut off the limb, I'm rushing you because we have run out of our time, but when you cut off the limb and you've got to put something, it's called a
artificial limb prosthetic, yes.
Yeah. So when you've got to put that, how comfortable is it? Does somebody ever heal completely to be able to feel comfortable in that thing and not feel pain while they walk? Yes,
with the right support, i.e. the prosthetic service, the physiotherapists, and obviously psychological support, very, very essential in such circumstances. They get on, and they get on to live normal lives. The key thing is the support and throughout that journey of recovery, which is essential.
I have a very interesting question.
Yeah.
I saw a friend of mine that got an accident, but they had a cast, that white thing where you can write you can put your signature as a heel. Yeah. But that cast literally causes a lot of itching. But remember, you cannot scratch yourself inside. It's one of the most traumatic things I've ever seen.
True.
Because we had to keep on sort of hitting it and all that. So how does somebody handle that?
Sometimes it may be that they are reacting to the materials that are being used. It could be the wool that we use, what we call the undercast. Yeah. So it's something to investigate. It's not a very common.
It's very uncomfortable.
It is. Have you had a cast?
I have not. I have seen my friend go through the agony.
Correct.
They want to scratch, but they cannot. It's big.
So usually, then go back to your treating team. And
they just told her to go home. They just told her to go home.
Okay.
And deal with it.
Yeah. But it's something to look into. You always have the option of going back to the treating team and say, look, do you think I'm reacting to something? If something doesn't feel right or is uncomfortable, then it's not good treatment. Review it, ask, check, and then if it means changing it, carefully of course, and changing the materials or putting on a different layer before the wool. And we have different materials available that do not cause as much reaction. So I'm sorry your friend went through that, but
it's fine. She's healed now.
Yeah.
So we've run through all our time. I'll just give you about a minute to say bye to our viewer, but also to tell us where can our viewers, how can our viewers be assisted at Nakasero Hospital where you work?
Essentially, thanks very much, our viewer. The key messages today: fractures need to be assessed properly, and go to the right hospital that has the systems that will help you do that. And be free with your doctors, engage with them, ask all sorts of questions, and then understand it's a journey to like how George has experienced it, from injury to full recovery. And it's not an easy journey, but with the right support, all will be good.
Okay, thank you very much for those remarks and for coming through.
Thank you for having me.
Absolutely.
Yeah.
And dear viewer, thank you very much. Always, it's a pleasure every single time we have you on our episode here at NTV Medical Matters. I am Viola Kusasira, and we have come to the end. And until the next episode, I hope you take care of yourself and understand that fractures take a while to heal, but with the right care, as the doctor emphasized, you can actually have your limbs back and functioning properly. We shall leave you here today, and we wish you a very, very fruitful week ahead of you. And until the next episode, bye.